This is a very delicate structure. One caveat to this is it's important to be cautious with treating this too aggressively. You have to be really cautious with what types of eye creams you're using. There's several different things that you may be concerned about when it comes to the skin. So the first is, you're watching or listening to this video because you have some concerns about your lower eyelids. You may feel tired, like you look tired, but you're not actually tired. You may feel like you just don't look like yourself anymore. You may be concerned about the darkness, the heaviness, the fullness under your eyes. Let's talk about the safe and effective ways to kind of improve those lower eyelids and give you the most natural, optimal, beautiful looking results. So if you like this type of content, if you're interested in surgical content, non-surgical content for facial aesthetics, like and subscribe, leave comments, tell me some of your thoughts. Give me maybe a future video that you'd like me to talk about, and I will maybe make the video for the next one. So let's jump into this topic. So let's talk about the lower eyelids. When you're talking about the lower eyelids, this is a very delicate structure, and it's important to understand the anatomy. If you don't understand the anatomy, then you may not be identifying or doing the right treatment for you. You know, buying eye creams may not necessarily be the solution for your eye bags. And so let's just briefly go over the anatomy. And typically the way I like to describe it is there's 3 layers that you need to focus on and think about to see what is the concern or what is the problem or the ultimate cause of what you're seeing. So the first layer is the skin. So the skin, there's several different things that you may be concerned about when it comes to the skin. So the first is texture, skin quality, skin texture, darkening. Those are the most common things that are oftentimes seen on the top surface layer. The lower eyelid skin is one of the thinnest skins of your body. It heals incredibly well with a lot of different treatments, but it also holds on to textural issues, pigmentation, and those types of things that can lead to darkening around your eyes. The next layer down is the muscle. This is called the orbicularis oculi muscle. It's a circumferential muscle that surrounds your entire eye and helps with eye closure. This muscle can cause creasing and wrinkling and rippling of the skin and cause a crepey lower eyelid skin. So if you have some of those concerns, then maybe the muscle could be part of the problem. We'll get into the details of how to treat that. The last layer is a little bit deeper underneath the muscle, and those are called eye bags. So all of us have fat pads that basically surround our eyeball. These are natural cushions that help to kind of control and cushion the eye itself, as well as the muscles around the eye. This helps us, they're essentially like bumpers for us as we go through our normal daily activities. And some individuals, either from a genetic component or as we get older, they become the barrier or the fence or, you know, the ultimate thing that keeps those eye bags or fat pockets in your orbit or in around the eye socket itself can become a little bit weaker, and you can develop eye bags. And so those are the herniation or basically the pooching out of the fat pockets around the eye, those normal fat pads that we have. So those are the 3 layers to think about when you're talking about the lower eyelid, and identifying which, cause or which concern is ultimately important. So let's talk about several of the treatments that are really important for you to understand which one is helping which layer. So let's talk about the first one that I really love, and I think it's really helpful. So let's talk about the top layer. So eye creams are and can be very effective, but because, as I said, this is a very thin layer, you have to be really cautious with what types of eye creams you're using. You have to make sure that they're gentle eye creams. You have to introduce products very slowly. You can't be too aggressive with this layer. And you have to understand that eye creams take time. It's really kind of more of a maintenance treatment, not the improvements that you're going to see from eye creams and topical creams are less about drastic improvements. It's more about kind of maintaining your overall results for other types of treatments. The other types of options that I really love for improving the under eyelid skin is PRF or PRP. This is platelet-rich plasma or platelet-rich fibrin, which are basically growth factors that can be used to improve the overall skin quality and skin appearance. These are fantastic treatments that can be done in the office to overall improve the complexion, color, and vibrance of the lower eyelid skin. You typically need multiple treatments. It requires multiple sessions, and they're typically about 4 to 6 weeks apart. But after those multiple sessions, you can start to see really improved vibrance and brightness of the lower eyelid skin, and it can help to soften some of those dark circles under your eyes. Another thing that I really love to do for the lower eyelids is actually laser treatment. So it depends on how advanced the aging changes of your lower eyelid. If it's the top layer that has some pigmentation changes, some mild fine lines and wrinkles, or some textural changes, a CO2 laser resurfacing is a fantastic treatment. You got to be careful. It's not for everyone. It's not for every single skin type, but if you have got good changes or good aging changes that are sufficient for a CO2 laser, these treatments are fantastic. You can do periocular CO2 laser resurfacing, which is just treating around the eyeball itself and kind of the eyelid, the upper eyelid, lower eyelid, as well as the cheek junction. Or you can do, more like the full face CO2 laser resurfacing. Going a little bit deeper, let's talk about the muscle. So if one of the issues is the crinkling of the muscle or the crepiness of the skin or some of that, those fine lines that you're seeing maybe around the surface of your eye, Botox, Dysport, Xeomin, Daxxify, these type of neuromodulators can be effective at weakening or relaxing that muscle so those creasing does not occur. One caveat to this is it's important to be cautious with treating this too aggressively. You can't get rid of all of that movement, and so you're still going to have some of those fine lines and wrinkles. If you treat it too much, or if your body is very sensitive to the relaxation of these muscles, sometimes you can get lymphatic disruption. And that's because that muscle helps to mobilize the lymphatic tissue. So with extra drinking, poor sleep, a little bit more stress, salty foods, that can cause lymphatic buildup in that area. So just be cautious. That can happen after this treatment. The last thing I would say is the eye bags. The eye bags are basically those fatty pockets under the eyes. There's a lot of over-the-counter, a lot of products that people are trying to sell for these. And I will tell you, don't waste your money and don't waste your time. Save your money, save your time, save your energy for a lower blepharoplasty. That is the ultimate treatment for these eye bags. This is a procedure. It does need to be done in the operating room for patient comfort and my surgeon's comfort as well. It's made through an incision on the inside of the eyelid, so no external incision. It's almost like an invisible procedure. There is definitely some downtime, so definitely be prepared for that, but the results are transformative. It is incredible. Patient satisfaction is so high. You don't feel tired. You don't look tired afterwards. And it's really a fantastic procedure. So if you have more interest in learning about other types of procedures or other types of treatments for lower eyelids, which there are others, leave them in the comments. I can make more videos about this type of content. Like and subscribe for more. And I look forward to seeing you guys next time.